My name is Lauren Warren, and today I will be presenting a paper on implantable medical device security. So, to begin, we can start with the introduction, which is what are IMDs? So, implantable medical devices are devices that are placed into the human body to support the treatment of diseases. And this basically means that they can measure the body's vitals, such as heartbeat and blood pressure levels, and they can administer drugs when necessary, like blood glucose measure devices for diabetics. And it's really important that they're able to communicate with the technology outside of the body so that doctors and physicians can monitor the vitals outside, and they can make sure that the device is adapting to whatever happens to the patient and the patient's changing conditions. So, how does the communication for IMDs work? In the past, IMDs were controlled, or at least the first few IMDs were controlled by short range communications under the supervision of a physician, and the patient would have to be very close to the physician for the IMD to actually function. And the control was actually harder to hack by an outside source because the range in which it could be controlled was so short, and because the patient had to be so close to whoever was controlling the medical device. Nowadays, IMDs are actually able to use long-range communication links, and they're much less invasive, and they can be monitored by the physician, and they can be monitored by the patient from home, which many patients use like their phones to monitor the device, or a wireless network connection, or they can actually go to the hospital and utilize the close proximity to the hospital and the hospital's network from the physician to actually monitor the device. And the security on this form of communication is not as tight as it used to be because the range of functionality is so wide. And yeah, that poses more security threats, as we will address later. So, what are the security risks? In an emergency situation, patient data regulations are relaxed, and patient data regulations are usually that only the physician and the patient themselves have access to the patient history and their data. But in an emergency situation, let's say something happens to the patient and it's a life-threatening situation, that data is then released, and basically anybody can have network to the implantable medical device. So this is basically a security gap because anyone can access the network and have access to the patient data, and they could actually get control of the medical device in a very emergent situation. And third-party companies are the ones who actually provide the connectivity for the devices. So they actually control how the devices are able to stay on these networks and how they're able to function. And these third-party companies are not well known to the hospitals who arrange this and to the patient, because they kind of basically just go out of network and they just hire out to try and get somebody who can actually provide that functionality. So yeah, those propose security gaps and put them at risk for attacks. For motivation and problem formulation, it's actually a little bit difficult to try and secure IMDs, and that's because they're actually pretty simple systems that don't have access to the longevity of batteries that like other types of computers do, and they have limited bandwidth, and they don't have much computing power. And some of the techniques that people have considered to try and secure these devices are strong forms of identification, shortening the distance required to control the device, and encryption schemes. And they want to secure these devices so that you can protect patient data and safety when they're exposed to any sort of wireless threat. And these devices are really delicate because they deal with the human body, so trying to secure them, that also poses another risk. And there is such thing as passive versus active attacks towards these devices. So active attacks are things that exploit the vulnerabilities and hijack the equipment, and passive attacks just try to obtain patient information and monitor the networks. And both of these types of attacks are done by adversaries, and adversaries are people who try to do anything to disturb the intent of the implanted medical device. So these can be from the inside attacks from medical staff or from the patient themselves, or they can be outside attacks from like people like terrorists or people who are looking to exploit the devices, cause any harm, gain some monetary gain from actually attacking the devices. And the methods which have been used to try and secure these devices, some of which include, one of which is biometric identification, which includes using your retina to try and scan, uses the patient's retina to scan to get access to the information of the medical device, or use their fingerprints to get the access from the medical device and the information. And so the example that was used in this paper was using heartbeat intervals as biometric identifiers to release the data to an external reader. And what they found was that the heartbeat intervals were able to prevent the both passive and active attacks, but they weren't that secure because outside eavesdroppers could still listen into the medical devices and still access the network. And it was also open to randomness because the heartbeat can change based on what the patient is doing at the time, such as exercise or any change in their vitals. And spoofing attacks were also possible because hackers could use the data that was recorded from previous identification sessions and just use that to still gain access to the implanted medical device. So the second method was using cryptographic keys, and those are basically things that you generate secure keys that can be measured anywhere on the patient's body. So they use the physiological receptors on the patient's body to actually access information about the medical device. And the example that they used in the paper was using retina scans, and the issue with this was that for something to be cryptographic, randomness actually has to abide by strict conditions, and physiological data does not do that. It doesn't, because it's always changing, so it's really hard to get it to be exactly correct and to abide by any conditions, really. So with the paper, what some of the authors found was that they created something called a fuzzy vault primitive, where they would use a set of elements, and the set was from physiological data, and the elements were used by researchers to actually unlock a secret value that the researchers had encoded, and the value would be unlocked if it was actually close to the original encoded value. And this could be unlocked by both the patient and the person who originally locked it. But the issue with this as well was that just really high battery consumption was a problem when it came to this, because the device is so simple that really anything that overexerts it could cause an issue. And generating so many keys can be really taxing on the device, and that's where the problem for that came into. So for the third method that was used, we had external devices, and these devices would basically act as a shield for communications that would go to and come from the device, and it would make it unreadable to an adversary who's trying to get any information from the device. And these worked pretty well, actually. The example that they used in the paper was a wearable device to protect a pacemaker, and basically what they had was the external device would act as a framework to really just intercept any communication coming from outside of the device, and it would identify any anomalies and enforce security measures for the device and for the patient. And it would look at the physiological data and see if what was coming in was actually matching the patient. And they could also encode and decode messages that were coming to and going from the device. And the fourth option was using machine learning, and that's basically where you would train the infrastructure of the device to actually learn parts of the patient and learn how the patient's vitals react to certain stimuli and just how the patient operates on a day-to-day basis. And the example that they used was the health guard framework, the health guard, to monitor the vitals and report on any attacks that were coming to the patient and to the device. So they would just go off of the vitals that didn't change independently. They would have to work with, each vital would have to work with each other, and it would alert the hospital or the patient when the changes weren't compatible with the patient's usual vitals that had already been recorded. So that would allow for there to be really no direct changes to the actual device itself, and that could prevent against data manipulation and any hijacking, and it would look at if anything is coming in that's not actually supposed to be there. And unfortunately, attacks within the network were still possible because you could still be working within the network and still manipulate the device. But if you're outside of the network, you could actually prevent that with HealthGuard. And yes, thank you. These are the references.